Well, good morning to you again. This is our final conference preparation, final lecture, final get together for uh, final preparation. And it is Friday, December the 11th, and it is 6:56 in the morning. And what I'm going to do is review the lecture for 8 and 9. I'm going to turn my light off here because what it does is it puts that funny light reflection in my eyes on my glasses, and I think it looks bad. Okay, I did put on uh, Canvas this information. The final opens Tuesday 12:15 at 8. It closes Thursday 12/17 at 11:59. Merry Christmas. It is an open book exam. You can use your notes, your text, your PowerPoint, or whatever. Merry Christmas. And that is also on Canvas. Now, you will have a little extra time in order to take the exam because you do have to search and look for some information. I do hope, though, that this means you're not going to prepare because you should. Some of the questions may take some time to find the answers. Also, there are questions on the exam over the girl in the window. There are questions on the exam regarding some additional or supplemental information that I have added that is not on the PowerPoint. So I encourage you to take notes on the previous lectures so that you are prepared and that you're able to find the answers that you want if you have to search. So please, please, please. Um, I know that COVID has put us all in a different place in our lives, mine included. And I don't know if that's what again happened in chapter 3, but I'm trying to be sensitive to that. But that doesn't mean you blow this off. Because if you blow this off and you're in special ed or LED, and you get a C minus or below, you're going to see me in the spring and you may not want to see me again. So please don't blow this off and just think, oh, it's going to be a breeze. It isn't a breeze. It will not be a breeze. You're going to have to work. So please keep that in mind, okay? This will be the last lecture. This is the review. However, as I've said, if you need to get to me and ask me questions, I am here. All right? Okay, let's get started. Um, the PowerPoint for Chapter 8 begins on my page 141 with dialect. The previous information is information that speech pathologists to be will get in other classes. And it's not information that is as pertinent for special ed and LED. You can certainly go back and read that, and it's information that you might find interesting. So feel free to do that. But for purposes of meeting needs, I felt that it was better to start with dialect. So what you need to do is review the difference between dialect and accent. You need to know the difference between those two and any of the characteristics that are assigned to dialect or assigned to um, uh, accent. Okay, so we know, according to Wolfram and Christian, that dialect is any given variety of a language that's shared by a group of speakers. So what that means is if you live in a certain region, most of the people who live in that region are going to speak, have a dialect, have an accent in a similar manner. And that's what that means. And there are some features that are characteristic of each one of those areas. We talked about a standard dialect and a vernacular dialect. We talked about accent as having characteristics of speech or the variations of pronunciations. For example, pak the ka, that is an accent, and that's characteristic of a variation in speech pronunciation, and we hear that in some of the eastern states. The dialect, on the other hand, is a language difference as well as speech differences. So there would be different vocabulary, terminology that is characteristic of a certain area. One thing that comes to mind, and I just saw this on the news, they were talking about weather actually. They called it a nor'easter, and a nor'easter is a term that reflects weather that's impending or weather that's happening in a certain area, and it has to do with weather that's related to those individuals who may live on some shoreline. And we do see those nor'easters up east. So that's an example of that language difference. And then ka for car in terms of the speech difference. Make sure that you review African American English and the origin, the history of African American English, and the other dialects that go along with the lectures: Asian English, Hispanic English, as well as Native American. Make sure you review Creolist theory. Excuse anything that I may say this morning that sounds strange. I have an earache and I get pain in my ear, and so I get a little distracted. Also, the difference between Pidgin and Creole. There are some questions on the exam about that. The Hispanic English, the Asian English, and the Native American English. There are questions on the exam about those 4 dialects. I believe I did mention this in one of the lectures for Chapter 8. Sometimes we don't think about Native Americans as being sort of a subculture of American Standard English, but they do have a very rich history, for sure, of many Indian terms. And you have Native Americans who live in the United States, and you have the Native Americans that may be slightly different that are up in Alaska. So don't forget Alaska as well, because we have Native Americans there. We have Native Americans in every state in the United States. We see them frequently in the southeast and up east, and sometimes it's due to weather-related conditions, climate, and their history with nature, the earth and the sky, water, crops growing, the sun. It's a very interesting history with Native Americans. Okay, that I believe covers chapter 8. There wasn't a lot, but I encourage you to read through all of those slides. Don't forget them. Now we want to talk about speech and language disorders in the home, school, and community, and that's chapter 9. And we talked about the importance of good communication skills, effectively communicating with each other on a job, in a job interview, um, using the skills that set us apart from other creatures. And it will be something that those good skills in communication will serve you well. But we do know that there are lots of communication disorders in our population. Those individuals who have poor communication skills, and that could be those with a developmental disability for sure, or those with special needs. It does lead to low income, it leads to poverty. They have some difficulty being able to sustain housing, paying bills, those kinds of things. But we do have agencies that will help in the support of that. Learning disabilities, it is a very, I don't want to say common, but in the public school, we have LD resource teachers. We have children who do get a diagnosis of a learning disability. So read that information about LD. This definition that has been presented to us by Van Riper and Erickson in 1996, this is a quote, "Speech is impaired when it deviates so far from the speech of other people that it becomes conspicuous, it's unintelligible, or it's unpleasant to the speaker or the listener." And I think that's just, it's simple, it's very clear, it's to the point, because if a communication disorder problem isn't bothering the speaker, you're not going to probably see much success in therapy. Read the difference between a functional disorder and an organic based disorder. Those are two different types of problems. The functional disorder, you tested, you've done everything, and you can't really come up with a reason for the communication disorder. And many times we have no idea what causes that communication disorder. We can't specifically pinpoint it. The organic disorder, on the other hand, is caused by a genetic syndrome. It's caused by some pathology, some disease process. For example, Parkinson's disease is caused by genetics, and that individual may have trouble speaking. The voice may be very soft, the volume becomes very low, and it's very difficult to hear. So we have some disorders that we know are caused by some medically based condition. As we talk about prenatal care and the prenatal environment, I want to grab my notes here. For infants, an infant is considered premature if they're born before 37 weeks. Full term we consider to be 40 weeks. Their low birth weight would be considered less than 5.5 pounds, 5.5. They have an underdeveloped vascular system, not just underdeveloped lungs. They have problems feeding. They have problems with the sensory system. They have problems with digestion. It doesn't just involve the respiration. Some babies may be in the NICU for months. They may have to initially be tube fed. Their development, those developmental milestones that we've talked about all semester. If we know what typical development is, that helps us identify atypical development, which leads to some type of intervention for that child. And we know that children typically sit at about 6 months, crawl at about 8 months, walk and talk at about 12 months, with a little leeway there. And so with these premature babies, when we don't really know what the long-term outcome is, what kind of trouble will they have in school? Well, if there's a baby born at 37 weeks, I have no idea what's going to happen. And so we begin to look for developmental milestones, and if they hit those developmental milestones, that's going to be a barometer for us as to what we might expect. We know that there are vision problems with our premature babies. We know that there can be hearing problems with our premature babies. In general, we know that central nervous system development is compromised. There may be more anxiety. There may be emotional conditions, ADHD, speech and language disorders for sure. That it can deal with memory, sensory, borderline intellectual functioning. It's the brain development, and the brain isn't developed fully. They may have sleep problems, seizures, they may have trouble eating, they may have trouble with that executive function that keeps you on the straight and narrow. The families do report other issues, such as the child being stubborn, more interested in things. And certainly with that interest in things, we do think of our kiddos who are on the spectrum for autism. They're very, very poor sleepers sometimes. Shy, timid, uh, they give up easily, highly frustrated. So these preemies are certainly kiddos that we will probably see on a caseload. And again, we have to watch the development of those milestones. So they're born before 37 weeks, 5.5 pounds, certainly uh, below that, and underdeveloped vascular systems, feeding problems and digestion difficulties, as well as problems with the respiratory system. And they are at an increased risk for communication and learning disabilities. You know, they're just not quite ready to enter this world, and for whatever reason they do. Um, Vision problems and hearing problems do also lead to learning problems, so we want to watch those kids closely. Early detection is crucial, as it is for any type of disability. The greater the hearing loss, the greater the impact on language development. The greater the loss, the greater the language impairment. As we look at visual defects, or deficits, I should say, not defects, deficits, um, we know with syndromes there's a higher incidence of hearing loss and vision deficits. And some of the same issues that cause hearing loss also cause the vision loss. You certainly can have one without the other, though. As we think about our kiddos in the classroom with a hearing loss, always keep in mind that 60 to 70% of classroom instruction is auditory, and you can't hear. So how much of that 60 to 70% of instruction are you missing? Well, it's really hard to tell. It's hard to say. But we know that our babies are getting newborn hearing screening tests, and that will help us identify them and identify any hearing losses early. High correlation between auditory, language, and reading disorders. 75% of early intervention kiddos with language disorders are also at risk for reading problems. Remember those 5 areas of language that we've talked about over and over again, and how a problem in one area leads to a problem in another area, potentially. However, the upside of that is if you can remediate one area, you may be able to strengthen one of the other areas. Listening is very tiring. Visually having to be attentive to something if you can't see well, it's very fatiguing. So also keep that in mind. Okay. Make sure that you've reviewed some of the potential problems, deficits that we see in vision and blindness. Review the developmental disability information, the intellectual, as well as the intellectual disability information. There will be questions about that. I want to mention the DSM-5 again, the Diagnostic and Statistical Manual, because you will hear about that throughout your career and how children are diagnosed. And if you're interested, I would Google the DSM-5 and look up the definition for autism. With autism, we know the primary concern is communication. It is socialization. We know that there could be maybe some stereotypic behaviors that go along with autism. These kiddos sometimes obsess about dinosaurs, or they're very obsessed with the weather, and if it looks like it's going to storm. They have sensory issues. And we know that there is a genetic component for autism because we see it run in families. We also know that environment may play a part, but when it gets right down to the nitty-gritty, we don't really know for sure what causes autism. So read that section on autism. We know they're poor conversationalists. They don't initiate. They many times are very self-centered and egocentric in their topics that they choose. They can talk about what they like, but they can't really engage in much of a conversation about things that they don't have a particular interest in. So their topics are limited. They don't express emotions very well, but we don't have articulation problems typically. That doesn't mean that they may not have had an articulation disorder when they were much younger in terms of the phonological development, but typically the phonological system is okay. Then review traumatic brain injury. I mentioned the Glasgow Coma Scale and how they're looking at eye response, verbal responses, and motor responses. This gives them a numerical rating, and it's used to assess the depth and duration of a coma and impaired consciousness. And we know that individuals who have had traumatic brain injuries or CVAs, cerebrovascular accident, their recovery is dependent upon how quickly they get medical treatment, the intensity of the medical treatment, the support system of that individual. And we know that typically children recover quicker than us old folks. And so all the more reason to make sure that we provide that intervention and get medical treatment for individuals who are adults or in the geriatric range. My TBI stuff, here we go. See what I want to highlight since you don't have this information in a PowerPoint. There are characteristics that we can look at for manifestations of a TBI by age, as in preschool, elementary school, middle school, high school. And we know that you can pretty much figure that they're going to have problems with some memory, could be short attention span, frustrations, um, and the higher the expectation is for language, the higher the level of language skills that we're expecting, that's when you're really going to see those problems. It will become much more evident. Our little ones, because they can't express themselves very well, will talk about, the parents will talk about the temper tantrums, irritability, they're crying, they're not good sleepers, they're not good eaters. Just this, it seems like just an underlying anxiety that our little ones have. Now, you'll see some of that also in elementary school children. Um, Difficulty learning new information. That is an issue. Inappropriate social interactions, and we see inappropriate promiscuity in older kids too. They don't they don't have fear. They don't think about consequences. Again, as the language load increases, the uh, performance decreases. Sorry. Kids are still learning new information as we get into middle school and high school, and they do have difficulty, again, learning new information. We're still seeing problems with short attention span, um, executive function deficits, they're taking risks. There's depression that we're beginning to see set in. And we see some of these same characteristics in an adult or a geriatric individual who's had a traumatic brain injury or a CVA, that cerebral vascular accident. So as a result of some of these issues that we see in an individual who's had a TBI, especially for our school-age children, where friendships are so important. Friends go away. They don't, and it's not because they don't like that person, they just don't know what to expect or how to respond. So educating them would be very important. Sometimes our teachers are frustrated. Families mourn the loss of that child that they had. We're also going to have the task of reentry into your classroom maybe. So the kids will have to be eased into a classroom. Think about talking to your class before the child comes back. Um, you can have the parents come in and talk about their child. If the child's in a wheelchair, talk about that wheelchair. You might have a Zoom meeting with the child at home, so that you can just dispel the fear and the rumors and make the child feel accepted. A lot of fatigue. They may have to ease back in. They may have to only come for short periods of time and build back up. You may have to adjust your curriculum, your style of teaching, but it's a team effort. They may now have a 504 or an IEP, whereas before they didn't. Their performance, their academic performance may suffer. Could have been a straight A student, and they're not now. So that's part of that TBI. You can review some of the information about TBI that is in the PowerPoint, and that is also going to be on the exams. So make sure you review the TBI information. Review the information on stroke, cerebral vascular accident. This is triggered by a lack of blood flow and oxygen. Review learning disabilities, a specific language impairment, we talked a little bit about stuttering, running in families, but between the ages of 2 and 6, it's a normal developmental process that kids go through, and you want to watch for tension in the voice. You want to watch for the child avoiding interaction verbally with someone. The increase in awareness will maybe keep them from conversing. So you want to be aware of the child's response to the stuttering. They may prolong sounds, uh, they may hesitate, they may repeat. So be aware of the behavior that you're seeing. Voice disorders most of the time are going to be referred to the doctor because you can't see the vocal cords. You have to have an x-ray, or they'll do some sort of strobe so they can see those cords. All right, we talked also about cluttering. So there is a condition called cluttering, and it's in the fluency range, but these children also possibly have deficits in language, and they sort of rush their speech. And then I want to talk about dyslexia for just a little bit. That was the last area that we covered, one of the last areas that we covered. And as I said before, dyslexia hasn't been addressed in the school system for many years. And now it's a law. The schools have to have teachers trained, and they have to do an evaluation, and we have to identify these kiddos. Dyslexia is a specific learning disability that is neurologically based in origin. It's genetic. It runs in families. We see probably the same number of boys and girls, whereas in autism or in fluency or stuttering, we see more boys than girls. But in dyslexia, there's probably an equal number. However, according to the research, boys get referred more because of their behavior. They get a little more aggressive, maybe, or show signs of frustration in a physical way. They have trouble with decoding. They're poor spellers. They don't read fluently. Word recognition can be a problem. And dyslexia affects all of the 5 areas of language: morphology, syntax, semantics, phonology, and pragmatics. These kids also have trouble with oral language, expressing themselves, sometimes pronouncing words, difficulty understanding what you're trying to explain. Now, I want to back up a minute. Difficulty pronouncing words. Probably everybody at one time or another has had a problem with that. But this would be something that would be out of the ordinary. You would expect a child to maybe say ambulance, Paschetti, something like that, but they would then eventually say it correctly. These kids would continue to have trouble pronouncing some words. It's the most common learning disability in the United States, and probably because we've ignored it for so long, and now we're going to identify them. Runs in families, and it is genetically inherited. One thing I think that can happen that's positive is that we can teach these kiddos to compensate for the dyslexia. They learned how to deal with their own disability, and that's really positive. And we see LD kids doing the same thing. These kids don't like to read out loud because they know they can't. They're embarrassed, have low self-esteem, and it has gone undiagnosed. They don't get diagnosed until they're a little bit further along in school, and that's when they've already missed out in so much of the early learning that takes place that builds. Learning builds, and they've missed out on that. Early intervention is key. Make sure that you even, think about this Orton Gillingham uh, teaching strategy. You might even want to look that up because it is very interesting, and you will be faced in the public school with dyslexia. Audiobooks would be good for these kids. Okay. All right, guys. I think I've let you know what you need to know. And there are other things that I've got on the test that I didn't maybe mention, but in passing. So I'm saying to you, make sure you read all the PowerPoints, make sure that you're staying up with all of the lectures. This will be the last time that we are together. Unfortunately, we couldn't be face to face all semester, which is how I really like to teach, and I do just really enjoy teaching, but given the circumstances, we couldn't. So if you have questions, you can always email those to me. I will answer those until the test opens on Tuesday. Have a Merry Christmas. Be safe. Tell your mom you love her. Okay? Bye.